So I like to start off with this picture. This is a picture of Tedros meeting with Jim Kim at the World Bank for the first time to talk about global health and where they're going. And as you can notice, there are not a whole lot of XX folks in that room. Let's go back one. Even when there are people in the room, a woman in the room, she often stands out. And I thank Megan Mahoney, I love this slide. She often stands out. And this is a picture of Michael Pence meeting with 30 men to discuss actually the future of maternity health care. This is for the new health care bill. So this takes me to my next slide, where you can ask, why are there no women in the room? Because women are really everywhere when we think about global health. 75% of the global health workforce are women. And when you think about what women do, they are taking care of all the health problems. And what I'd like to do is, Ashley, can you help me make this? This is a great video. This should wake you up. It's a video that the Gates Foundation put together for our conference, and it really talks about where women are. Go.
There's an old friend that I once heard say something that touched my heart, and it began this way. I was born by the river in a little tent, and just like the river.
Sedan igenom Pedimi magwadarolik Martin and Marvelikal.
We are tired of war. We are tired running. We are tired of our children being raped. Kindly convey this to the president of Liberia. Thank you.
Oh yeah. And when I
Sons and the withdraw, never.
I was right back down and on my bended knee. Yes, I was. Oh, but I know a change is gonna come.
Speak truth to power, tell him what it is you want, and then let history be the judge of all of you.
I got the eye of the tiger, dancing through the fire. 'Cause I am a champion, and you're gonna hear me roar louder than a lion. 'Cause I am a champion, and you're gonna hear me
So film shows you that women do protest, and it got me really angry when I was in Africa and was at this huge meeting of medical deans from around the entire continent, and it wound up, instead of all white men, I saw all black men there. So I actually went to the Gates Foundation. Actually, there was one white man on the stage, and that was Francis Collins from the NIH. He came down and he said, do something about it. Because when I said this, I got a standing ovation from all the African women in the room. I actually raised my hand and I said, if you want to go forward, you need to look at who's on your podium. And it was striking that there were no women, even in that setting. So because women, if you think about the global health workforce, you can see that even though on the bottom, I would say about 80% of my students are women that do global health. Home caregivers, as we all know, are primarily women. But if you look at the Fortune 500 healthcare workers, CEOs, you see that it's only about 4%. And deans in medical school, we've actually dropped down from 25% to 16%. So, but women are really everywhere in the global health workforce. Even though they face lower wages and family unfriendly policy, they wind up earning dramatically less than men, even within a specialty, up to 20%. And maternity leave is not a universal right, as we all know in this room. And even in nursing, where you would think that the majority of women are in that force, actually they're not in leadership, and they earn less. And if you look at nurse anesthetists who make the most of those wind up being men. So think about that. There's a tremendous amount of gender inequality. And let's see, I want to move that. But if you think about what health activities women do, they are all about taking care of the sexual and reproductive health of a family. They're about health literacy. They're about breastfeeding. They're doing the antenatal care. They're doing the hand washing. They're doing the early child vaccinations. They're doing microfinance for the house and giving back to the house. And yet, we are not getting to the top of our leadership, particularly in medicine and global health. And this is a compilation of women in just academic medicine. And even though and Bonnie can talk about this as well, because she runs the diversity for the school, we're about 50-50 women in our class. But as you can see, when we go up from medical graduates to full professors to deans, we're pathetically falling off the pipeline. And then there's some really horrible statistics that not only do they have lower salaries and less likely to hold tenured positions and less likely to have endowed chairs, more than 50% of the faculty and staff and 70% of medical students and postdocs report sexual harassment impacting their health. These are really awful statistics. And then I like this picture because I call it the mustache man anomaly. Only 13% of women were chairs at NIH-funded institutions in the US. And if you do a sub-analysis, you know how we like to do those sub-analysis? We actually found that men with mustaches as chairs outnumber all women as chairs in US medical students. Just take that and sit about that a little bit. And when we look at ethnic minority women, they do even worse. I mean, ethnic minority men don't do so well either, but if you look at what's happening to our junior, mid-level, and senior women, they're dropping off dramatically. And when we look at grants and who's getting grants, we do pretty well with the research training grants. It's about 50%. But if you look at the basic small business innovation grants or the RO1s, we are dropping dramatically. And now you may say, well, women just don't apply. And you're right, there are a lot of men that apply. There are a lot of women that apply, but as you can see, women are not getting the awards. And this is you can shake your head about that, but this even pisses me off more. Even when they get the award, they get much less money, dramatically less money. So, why is this happening? Why is this happening to women in research? Well, I contend that this is one of the reasons. You know, when we think about what our academic currency is, a lot of it has to do with publication. And a lot of it has to do with publication in the more prestigious journals. So Lancet is my journal, because that's the global health journal. And Richard Horton and I have talked about it, but only a third of the papers in the 10 Lancet journals have a female first or last authored paper. But more importantly to me, why is this? 72% of the peer reviewers are men. So if you think about it, and they're not blinded, you can't tell me that that doesn't play a small role. And I don't know if anybody was here when Howard Bachman, is that his name, from JAMA was here. And he actually, I raised my hand, he gave a wonderful lecture on transparency in JAMA. And he basically said So I raised my hand because I've been fighting with Richard Horton about this in Lancet. I raised my hand, I don't know if anyone was there, and I said, well, Howard, that's a wonderful lecture that you gave. Can you tell me what % of your reviewers for JAMA are women? Remember his lectures on transparency. He actually wouldn't reveal the number. He said, we're working on it, Michele. We'll get back to you. We're working on it. Well, so I raised my hand again. I said, well, that's okay. That's all right. Tell me what % of women do your editorials. Those are invited editorials. You should know that off the top of your head. And he had, I couldn't believe he had the chutzpah to say to me that I have lots of women on my editorial staff, Michele, and they tell me that JAMA is not a training ground for editorials. So to me, that implies that there are not enough women that are able to do those editorials. I just couldn't even answer after that, and I got many emails afterwards that day, and I've subsequently emailed with Bachman to talk about that. But this just tells you that's a lot of the academic currency, so we need to think about that. I'm sure everybody in this room has heard of the term MANLs and the pledge for people not to, for men, your male colleagues, and I see some brave men in this room, to say, I won't be on a panel if there are only men. And I think we need to think about how we can do that. And at the bottom of that, I love that, an all-male panel at the Global Summit of Women in Paris. So it becomes a vicious cycle. You get poor representation of women reviewing, peer reviewers and authors. They wind up getting fewer publications, less funding, and you can see how this is a cycle of less promotion. I want to say a few words about Japan. I don't know if anyone saw this article in the New York Times a couple of months ago, which basically showed that the medical schools there were discriminating against women. The test scores were rigged. Women were actually wound up being awarded only 20% of the medical degrees because the reason given, and there is a cultural difference. I don't know if you read the follow-up, how women do all the housework no matter how much, it's a cultural difference in their setting, but the reason was given that women drop out of medicine to have babies. That's just simply unacceptable to manipulate scores of medical testing. So there have been a lot of organizations that have worked to try to push this issue. WHO has this whole thing about gender mainstreaming. They just had a Lancet, well, we can talk a little bit about that. But basically, Tedros has tried. He's appointed 9 out of 19 appointees are women. But can I tell you, already some of these women are being sidelined. So that we need to keep an eye on lip service for people to be appointed, because if you're not given authority in the appointments, you need to shout it out. So what are the obstacles of gender parity? And I'm going to stick to my topic. I'm a humble tropical disease doctor in global health, so I'm going to tell you, when I got angry and Francis gave me that money, we held the first summit here for global women to talk about what is some of the problems in climbing that institutional ladder. And here's what some of the problems were. They fell into 3 buckets, and I've written about this in 3 buckets. Challenges climbing up the institutional ladder, and that's gender bias and discrimination at work. I would say in resource-poor countries, this is not subtle. It's not the gender stereotype, the unconscious bias that we all talk about here. It's really overt bias in resource-poor countries. And I want to raise this concept of the glass cliff. I think we're seeing it with Theresa May. Not that I love Theresa May, but she was put into it. The concept is people are put into, women particularly, are put into jobs where they're right at the cliff in an organization that's not doing well, and then there are expectations and they fall off. You know, she was put in charge of Brexit after that whole vote, and I think this concept of cliff we need to start thinking about versus the ceiling. There are tensions between career and family responsibilities, and I'm sure everybody in this room feels this one way or another. You don't even have to have children, because I'm part of the sandwich generation. I have a 94-year-old father And then this weekend, I have a daughter and a granddaughter getting married. The daughter's getting married, not the granddaughter. So I'm a sandwich generation. So even if you don't have children, you have responsibilities. And your career building, for most of the younger people in this room, it's really your height of when you're going into tenure is during your reproductive years. And if you look at when you get your first RO1 now, it's like 42, 43. What is it, Bonnie? 46, even worse. So you should really be at working during those reproductive years to get to that first RO1. And then for me, for global health, how do you go abroad and juggle your family and take, I just wonderfully had an okay spouse who would come with me and take care of children when we were overseas, and we were economically set up to do that. But for younger folks going abroad, it's often hard to juggle. And then the third is health and safety issues for global health. I've had several colleagues that have been raped. There's a concept of personal safety that you always have to work around in the developing world. And we talked about the harassment. So so those are the buckets of problems. I'm going to give you some potential solutions that I hope you think about for climbing up the institutional ladder. The first is how do we get up that institutional ladder, and how do we make sure that the women getting up there are not pulling the ladder up behind them? I actually think very few women do that, and I'll give you some data about that. But I think good mentorship, and I'm going to spend a little bit of time of what we're going to be doing with the Gates Foundation on women leadership in global health, a large initiative we're starting. And I think we need to think about our partners overseas, for those of you who do global health, that we need equity. And I'm about to start a gender equity initiative in promotion so that our colleagues overseas get taken into the whole cycle of high-income countries' promotions as well as low-income promotions. I think we need to think of them as partners. The tensions between career families, obviously we need to have time extensions to accommodate maternity leave, child rearing, elder care. We need to do better gender education, shouldn't be health education, gender education in resource-poor countries, and I'll tell you a little bit about what we want to do. Because I don't think it's about fixing the woman in leadership. That sounds a little crazy. I don't think it's only about giving leadership skills. It's about changing the environment they go into as well. So I don't care how many skills you give a woman, if you put them back in a toxic environment, it's just not going to work. And then health and safety, I think, can be, if one thinks up ahead, you can strategically manage them and mitigate those research. And then those issues, and then obviously sexual harassment training. So I do want to spend a few seconds about women leadership in government, because that actually leads to gender responsive policy and increased health for the family and global health. It turns out when you have, and since we're in the midst of this presidential campaign where there are many women candidates, this is something else to keep in mind, that when you have a woman leader in government, turns out less inequality in pay, positive relationship between women ministers and confidence in government, more public health spending, and gender impact assessments of policies. And those all become incredibly crucial to actually get inclusive growth and trust in institutions. So you have gender diversity in decision-making, effective gender equality institutions, and this concept of gender disaggregated data. I don't know if you've talked about that in this meeting, because I was elsewhere this morning, but that becomes, when you look at situations in health particularly, we need to have gender disaggregated data. So those are the hard facts. This talk is called Hard Facts and Debunking Myths. So the first myth I want to debunk is the queen bee myth, and that's the myth that women are in position of authority, are harsher, more competitive, and hold women back from achieving success. Well, here's a very nice study done in Brazil that debunked the queen bee syndrome, and it's a really robust study. They looked at 8.3 million organizations and municipalities led by women in Brazil. If you had a CEO, they looked at your middle managers and how they progressed up the ladder. And it was really, the statistical significance was very high. That women who are in leadership hire more women, and they tend to raise them up the ladder. The myth that women avoid making risky decisions comes out of the financial hedge fund literature. And yes, women in finances tend to be more conservative and make less risky decisions. But when we look at some of these women, there are very strong women out there who are not necessarily risk averse. You may not actually agree with some of the policies of these women, but they're definitely women who are risk averse in leadership settings. And I think we need to think of risk in a different way. So I don't think we should necessarily think of it as risk averse just in leadership and taking risk. If you look at when women actually stand up on ethical, they may not be so risk-taking in finances, but when you look at the ethical and moral stances of some of the problems, it's women that are the first to open their mouths. And there's been a meta-analysis of 24 studies that showed that basically some of this stuff about being risk-averse, even in finances, have confirmation biases. But there's truly less emphasis on being afraid of taking an ethical stance. Women are less committed to their career than men. That's another myth that we hear often. And I like this picture. Here's a woman that is committed to both her family and her career. And in actual facts, I think when we think about this, we need to redeform what normative work and family roles are. And I'm sure many of the women in this room get asked to talk about family-career balance. I don't think it's about balance. It's really about family-career integration. It's a really better way to think about it, because I think no one's giving up their family. We all love our family. We love our kids. But basically, this is a wonderful article by Chung and Halpern that really it really approaches how to integrate work and family circles and how to use family support to ascend the leadership ladder and how to develop life management strategies. And there, on the right, it's a jigsaw, and I don't think you can read that, but in the middle, when you look at, if you can read it at all, it has a jigsaw puzzle of the family, how you're going to read with kids, and at work you read with papers. And then if you look at the work-family interface, sure, you can read papers, but have your research assistant, I have a wonderful one in the room here, have her or him read it, and while you take some time to read with your kids. So this is a very nice graph of a step-by-step model leadership for incorporating women and family roles. And if you have some time to read that paper, highly suggest it. I'm not going to not talk about LGBTQ women. There was a very nice Lancet article that showed that this is even a more hostile setting in academic settings. And this Lancet article just came out a couple months ago, really talked about how there's very few supportive environments, and we need to think about how to recruit LGBTQ women, how there should be non-discrimination policies, funding and scholarship, internship and mentorship, gender-inclusive spaces, anti-violence, and more research on transgender health. I can tell you, and I know Marcia's quite good about this in the center, thinking about this, but I can tell you in medical school, I was taught nothing about transgender health. And I don't know how, we have courses now, right? Not really.
We have one, Clear Health and Medicine, everybody take it.
But it's not been mainstreamed.
It's not required.
It's not been mainstreamed, which is, yeah. It's talking to the choir. So anyway, just let me step back and tell you, I am a tropical disease doctor, but I got passionate about women leadership, and it started out with the conference I told you about. We put this out thinking we'd get a couple hundred women from around the world. 1,500 women applied to get into our conference, and we had to live stream it to thousands. We were only able to incorporate 400 participants at that time. And then the second conference, when I was there, London raised their hand, the London School of Tropical Medicine. We'll do the next one. And that one had 1,000 women and also turned away another 1,500 women. And they're very inspirational meetings if any of you have gone to any of them. The third one is, by the way, in Rwanda, November 9th and 10th, and it will be focused on African women themes. But it will be a global. I highly suggest it if you can come. It's a 2-day conference in Kigali that Agnes Bingawaho is leading. What were some of the take-home points from these two conferences? One, that diversified leadership can lead to better outcomes, and there is some data on this. There's certainly data in the C-suite about how diversified boards lead to better outcomes in companies. That we talked a little bit about how institutional change is necessary to prevent what I was saying. It's not fixing the woman, it's fixing the environment. I would say it's also about engaging men. We cannot have these audiences of just women. I'm looking and seeing just one or two men that are sitting or standing in this room. In order to change anything, we need to engage men. And we need to think about the cultural stereotyping. And again, we need to go across generations. So this is a nice pictogram about an article we wrote in Lancet: increase visibility, lift women up ladder, advocates for work-life integration, eliminate the pay gap, thought leadership around gender, the gap, and accountability and process. So these are all apple pie, but how do we get there? So I contend that we can get there by a movement that has equity, inclusion, humility, creativity, and self-care. I am really pleased with you, any of you that do events. We came up with an event checklist that you should be doing. When you do an event, is the marketing presented in a gender-balanced way? Do you have as many female or male panel keynotes and moderators? Do you have gender parity in your review of the abstracts? Other than gender, have you thought about the diversity of your organizing committees and your participants? And have you encouraged, this is a new one, I'm sure you've been following it, even with animals. You know, most of the animals that are used in basic science are male animals because it's too messy with those Menses stuff. But think about that. Most of our drugs, there was just a recent in the Science Times a couple of weeks ago, I don't know if you saw that, about how most of our drugs have only been tested on male animals. So we need to encourage session organizers to use gender analysis of science. So sitting back, it's been 3 conferences, and we felt like a conference is just not enough. We got to push past that conference, and we got to scale. And so I was very lucky to have a wonderful woman in the Gates Foundation who encouraged me to put together a grant on actually going past just the conferences, but developing network advocacy, research, and training, and actually transform this triangle, which you can see the decision makers in global influence that are women, are very small, but get a woman to go through the labyrinth, and it really is a labyrinth, and we all know navigating the sharks or the labyrinth, whatever you want to call it, to get to the future triangle becomes important. And we've spent a lot of time thinking about a theory of change. How do we catalyze this change and empower these women? And so one is raising awareness, and I think we've done a good job with this, with the conferences and convenings. I think we need to have the stories from women leaders out there. I don't want Howard Bachman telling me that he can't find a damn woman for an editorial. We should have searchable databases for women scientists, and particularly in women in global health for me. I think we need to develop curricula and toolkits for leadership. I know Bonnie's done a great job with the diversity leadership training here, and we need to keep this up on the social media. For empowering leaders, we pitched to Gates about setting up geographic hubs around the world so that we can have branded certification of a 1-year leadership journey with culturally appropriate content. Leadership in the US is different than leadership in Rwanda, which is different than leadership in Ghana. There are subtleties of leadership training that I think we need to think about. So we pitched a curated leadership journey in which it'll be 1 year. We have a very bold plan. We want to train 3,000 women over 10 years. And we want to have really just a light touch on one-on-one. There'll be cohorts of 25. We're going to open one hub in Stanford. We're going to open one hub in India and another one in East Africa. The CEO of the organization, and this is not just academy, this is public sector, private sector, it's not just academics. We really want to get to those government and also NGOs and make sure women are in leadership positions there. They will have to have their CEO or head of their organization come through the curated journey with them. Remember, we talked about changing the environment. We're working on how we're going to do that. Short residencies, and then during the whole time there'll be an executive coach with lots of soft touches. And again, the coaches will come from the geographic areas that they're working on. And I think this has a chance of catalyzing change with transformative real-world projects, strong regional networks, strategic partnerships. We're having a big fight. It's been really wonderful to put this together, and we have gotten a multi-million-dollar grant to do this. But it's been wonderful to see women crawl out of the woodwork to help us. McKinsey Global Leadership Academy has been doing pro bono for us. The Center for Creative Leadership has been doing pro bono, and we're probably going to hire them. The ELAM, Executive Leadership for Academic Medicine, Nancy Spector has helped us with this. We're working to have them. When we get this curriculum and toolkit, we want to make sure it's free access, that it's not just for these women going through the 3,000 women, but that there will be a ripple effect. I'm going to end. These are some of the women that I've had the privilege of mentoring or being with and in global health. And I'm going to end because this is the reason why I'm doing this. This is my new grandchild. She is a girl, and I want her not to have the barriers that we've had. But thanks for your attention.